House Democratic leaders unveil a health bill. They're going to unveil a health bill. Say that, but that's hard. Unveil health bill. Unveil health pill. They're going to anvil a health pill. They're anviling a health pill. The House Democratic leaders, they got a health bill out there, and it does not have Medicare for all. You want Medicare for all? Tough cookies. The House Dems, they ain't doing it. All right, so let's look at what they are doing. The House Democrats' divide over healthcare will be on full display today, that's Tuesday as of the recording of this, when leaders plan to fulfill their midterm election promise by rolling out comprehensive legislation to strengthen the Affordable Care Act. The bill aims to protect people with pre-existing conditions, which is as well as lower healthcare costs and reverse the Trump administration's move to weaken Obamacare. So they're not strengthening the Affordable Care Act, they're just trying to get it back to where it was. That's it. House Speaker Nancy Pelosi, along with several committee chairs and freshman lawmakers, are set to unveil the legislation at a public event designed to mark the 9th anniversary. What's not in the bill? Anything resembling a universal Medicare for all plan, a version of which was introduced by Pramila Jayapal and Debbie Dingell of Michigan last month, and has more than 100 co-sponsors. Pelosi acknowledged the goal of universal health care in a statement over the weekend, saying, as we mark the 9th anniversary of the Affordable Care Act, we reaffirm our commitment to this fundamental truth, that healthcare must be a right, not a privilege for all. But it's not about getting everyone healthcare. It's about ego, and it's about this incremental approach that's not really going to do anything. They're not even strengthening the Affordable Care Act. They're just getting it back to what it was. I mean, whenever you hear people talk about strengthening the Affordable Care Act, I've been asking for a long time, you've been asking for a long time, we've all been asking for a long time, what exactly does that mean? Nobody has a cohesive answer. And I'm sure this legislation will have more of the same. It will have more of nothing. Because you know what strengthening the Affordable Care Act means? You know what strengthening the Affordable Care Act should mean? Going to a single-payer Medicare for all system. Because that's how you strengthen something like the Affordable Care Act. Because the Affordable Care Act, what did it do? It let the insurance companies at the table. They got to go bye-bye. They got to go bye-bye. Because that's the problem with our system. That is the problem with our system. And you can say, well, Ron, even though most countries do have a universal single-payer style system, Switzerland, they also do private insurance like we do. And they rank better than us. Yeah, they're about 20th. We're a lot lower than that. That's true. Why do they rank higher than us, Ron, when they do a private system too, like we do? Well, because their private system is way, way different. Their private system has a lot more protections that the government oversees. In their private system, there is a basic universal coverage that everybody has and that everybody has to purchase, but it is overseen by the government, and no company can make a profit off of that coverage. So yes, it is private insurance, but there is a lot more oversight, which is why they're ranked so much higher than us. But because it's private insurance, that's why they're not ranked a lot higher. That's why they're not in the top 10. So we are the only industrialized nation that does healthcare the way we do. It is by far the most inefficient model. It is a predatory scheme, and it's a scam. And we just casually accept it. We just casually accept it because we've been spoon-fed the propaganda of socialized medicine, quote-unquote, for so many years. And we're finally starting to see through it. People are finally starting to say, yeah, you know what? We should all have health care. We should all just pay into the system. The government does the bookkeeping, and we can go see a doctor. We don't have to deal with all this red tape, middlemen bullshit anymore. That's what most of the country wants. Most of the country wants Medicare for all. But the Democrats, they won't even say it. And now they're unveiling this bill that's going to strengthen the Affordable Care Act. Which basically means just bring it back to what it was. And where was it? Well, 30 million people still don't have care. 30 million people. And it's Mitt Romney's healthcare plan. So the Democrats are unveiling a plan to strengthen a right-wing healthcare plan. They call it Obamacare because it's all about ego, and it's all about branding, and it's all about marketing, and it's all about just propagating their side. Why is it relevant that it's the 9th anniversary of the Affordable Care Act? Why is that relevant when it comes to trying to get everybody health care? Because this isn't about getting everybody health care. This is about ego, and this is about the hyper-partisan hack game between Republicans and Democrats, who at the end of the day are just part of one party, the money party. Who gives a shit that it's the anniversary of the Affordable Care Act? I can think of at least 30 million people that don't give a fuck.
Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Get your news on with Ron. Don't you want to know what's going on? We're getting our news on today. Yeah, yeah, yeah. You can tweet me an article at Ron Placone. We'll go through it together and make it our own. Get your